turn now to Mark Frazier, who is ConocoPhillips Professor of Chinese Politics and Associate Professor of International and Area Studies at the University of Oklahoma. He's written on Chinese labor and also on Chinese welfare, and I guess is leaving Oklahoma for the New School over the summer and will be the director of, is it the India-China Center at the New School?
India-China Institute.
Institute.
EC as it's shortened to. Oh, I think even though I don't have a PowerPoint, I'd like to speak from the podium if I may. Well, I'll say and confess that I know India through a little bit of airportology and hotelology, which, by the way, hotels are better than the airports. The taxi cabs is an experience in bargaining, isn't it, every time. But I do hope in the future to learn about India through a little bit of archiveology. I've done work in the past in Chinese historical archives, and I'm looking forward in the near future to go to the archives in India to look at some of the debates over social policy, over social justice that were held early on in the history of these two countries, as well as more recent efforts to, as was mentioned earlier, post-2005, both governments trying to do something about reducing the inequality that the growth trajectories have created. So many in the audience already know this, but I think it's worth pointing out. We've heard with the comparison of China and India, you might think that all China scholars view the Chinese state as remarkably powerful in its state capacity and this well-oiled engine. But of course, there is a vibrant debate going on among those who work on China, some who see declining state capacity as a very serious problem in China, versus those who look at the same state, of course, and see resilience, adaptability of various forms. And I think in both instances, it really comes down, at least in large part, to how one characterizes the local state in China. Some people see unruly but generally manageable local agents in townships and urban districts and so forth. And others, of course, look at the same officials or look at other parts of China perhaps, but anyway, they come to the conclusion that these local agents of the state are undisciplined, abusing power, and eventually, or already, are hollowing out state capacity from the bottom up. And in these brief remarks, I'm going to just take one case of a relatively successful governance outcome, and that is the unlikely story of the transformation of China's social safety net. In the book that I published in 2010, I make the point that this vast project in creating a public pension system is evidence of an impressive expansion in state capacity, but one that is ultimately derivative of government capabilities and embeddedness in a highly diversified landscape of firms and workers. Brenda talked about the history of states, and I just wanted to mention here that welfare states, as we sometimes call them, are very recent in the overall history of industrialized states. And we view these states as having high levels of state capacity, depending on their age or not, but we do know that the whole notion of a state providing, rather than families or non-government agencies providing some form of safety net is a relatively new development, at least 20th century kind of early 20th century development. But I would submit that there are very few other countries that could embark upon the social welfare undertaking that China did in the 1990s and 2000s without provoking active resistance and evasion by employers and even workers. This project involved local urban officials going around to enterprises in their jurisdiction and asking for a 30 to 45% payroll tax to fund public pensions, to fund unemployment insurance, to fund health care insurance, workplace injury insurance, and even paid maternity leave policies. These 5 forms of social insurance. Employers did fight against these levies. There were many bitter debates between firms, and especially high-ranking state-owned firms, and these local governments. But all in all, I think we have to consider the social insurance project a success. Today, we have nearly universal health coverage in urban areas. Again, we could throw out the American comparison. America hasn't looked so good today in terms of prisons and healthcare and other things. Nearly universal coverage in urban areas. There's still a large group of migrant workers who are uncovered, but that number is increasing. Of course, we have health coverage expanding via the rural medical cooperatives, which is a separate kind of system, but it's still important to point out. We have nearly universal public pension coverage for urban workers, again including migrant workers, or an increasing number of migrant workers. And something like pensions alone takes in to the Chinese state, of course it's earmarked for paying current retirees, but you're talking about 1.5 to 2 trillion renminbi per year, an incredibly impressive number for a program that not many people think about. And I think the reason that this undertaking was successful eventually has a lot to do with the legacies of governance of urban enterprises, state-owned enterprises and collectives dating back to this important Maoist period that we've already talked about on the first panel. The successful adoption of an important public good like social insurance, I think, has less to do, or I would say is perhaps not as important to think about whether there's some explicit or implicit socialist social contract, of which there's some legacy today, but more to do with the local state's techniques going back to that time to render urban workplaces as legible and in some ways numerable entities. And by that, I mean the local state's ability to record. At first, of course, in the Maoist period, it was these politically laden dossiers. Every worker, every employee has this dossier that's kept on their behavior. Today, we have digitally recorded and digitally stored by these social insurance agencies an employee's, not their political activity, but their time of employment, rates of pay, contributions to retirement accounts, contributions to health savings accounts, dates of employment, of course, healthcare reimbursements, all of this data, a whole gamut that would kind of make a dark sequel to Seeing Like a State, which was about geospatial things, and this is another thing indeed. One of the social insurance agency officials I remember very well boasted to me that he possessed more information on the workers in his city than did his counterparts in the Public Security Bureau, who after all were just after household registration, or the tax officials down the street who were just worried about revenues from enterprises. I wonder what he would think of the biomedical ID that was brought up in the first panel in India. Probably something he would be very interested in.
Don't give them more ideas.
Yes, let's make sure that doesn't get out there. Finally, what does this social insurance project tell us about general governance patterns in China? Well, from my reading, it was not a mobilizational effort. It wasn't a campaign of the sort, or even a managed campaign of the sort we've seen some of in recent years. Nor was it a project driven by grassroots NGOs or political entrepreneurs as part of a policy pluralization process that some have written about in other policy domains. It was arguably a crisis-driven kind of response to the mass layoffs of state-owned enterprise reforms in the 1990s, certainly. But I think the best way to characterize this story is one that reflects in many ways the traits of what Liz Perry and Sebastian Heilman have described as policy experimentation under hierarchy, or experimentation under hierarchy, where, in this case, urban governments are given a wide degree of latitude to experiment, to be practical, to experiment with different kinds of policy designs for these programs throughout the 1990s. And some of these programs eventually become national policy. What is also noteworthy is the willing adoption of international models in the study of foreign practices, not just by the central government, but by urban governments in Shanghai, Shenyang, and elsewhere, who were sending delegations to Northern Europe and to Singapore and all these places to try to study what can we do to, what can we learn from them in terms of adopting a social security or pension system. Another and final point about this policy or experimentation under hierarchy is that experiments and then local experiments and then tentative, incremental, very vague national policies are passed at the central level. And at the very end, in fact, after my book came out, the social insurance law comes out in late 2010, and it is an attempt to, even though it was very vague as well, to codify some of these things that have been going on for a long time. So regardless of how we characterize this in terms of governance or policy style, I think it's important to point out that the social insurance undertaking does have its flaws. There are serious problems in terms of redistribution because it is so heavily decentralized and difficult to move money and subsidies across cities, let alone provinces. Many urban governments refuse to join a risk pool at the provincial level that would reduce the cost of some of the poorer areas within a province. In comparison with India, in comparison with India, China's new social insurance funds are impressive. India has many of the problems that you see with post-colonial cases of provident funds being set up by colonial governments for civil servants, for military officials, and for a small, maybe 5 to 10% of the industrial workforce who are covered by them. But the interesting contrast is in India's recent proliferation of social rights legislation. One of them was mentioned already, the Rural Employment Guarantee Scheme, also derived from a successful program in one of the states, but done so in a much more federal way, as you would see in federalist systems which are supposed to have these laboratories of policy experimentation. The problem, though, seems to me that Indian states, as Devesh just mentioned, are not able to fund the social programs because, unlike in China, they lack the capabilities and the history of tracking firms and their employees. So this crucial variable in financing public goods through local government actions, local government behavior, I think lies in the ability of these local firms in China to go around and credibly raise funds from local firms. In other words, collect revenues from employers for public goods provision that have some degree of legitimate authority and credibility, that they won't be completely embezzled or spent on personal or private use. Now, we can talk about the Shanghai pension scandal, which was a big example of the latter, but in some ways you could argue that they found it out and the problem has been taken care of. We haven't mentioned Chongqing today, but we could do that too in terms of a social policy model and whether it will continue as such, given Wo Xilai's fate. Thank you.
Thank you very much.